Andy Johnson. We are looking at marijuana and mental health issues. First of all, a 2014 study looking at the percentage of adolescents who are current users of marijuana. Ages 12 to 17, 7.4. College age, 19.6. And 26 and older, 6.6. It is the most common illicit drug used. Why is this concerning? A number of reasons, foremost among them, it can critically alter the developmental process of the developing adolescent brain. It disrupts the ability to test reality, reason, control impulses, which high school kids are hopefully learning to do, set priorities, and relate to others. And again, adolescence is a time of understanding your social self and your emotional self, and it disrupts the ability to do that. Contrary to popular belief, marijuana does not enhance creativity, as measured by divergent thoughts, the ability to generate a lot of different ideas. As a matter of fact, it reduces divergent thinking. The effects on the neurocognitive function has been shown to lead to deficits in processing speed and working memory. Short-term memory is impaired. What? Difficulty tracking conversation as the information becomes more complicated, and the sense of time is altered. You tend to do things more slowly. Long-term effects include poor educational outcomes and reduction in IQ as measured by standardized tests. This is adolescents' use of marijuana. Motivation is adversely affected as well. It messes up the dopamine receptors. Compared to alcohol users, marijuana users have lower energy and motivation and perform lower on measures of school and job performance. Now, looking at medical marijuana, first of all, the potency of marijuana has increased substantially in the last 20 years. In 1995, the average THC levels was less than 4%, and today it is greater than 12%. Now, there is strong evidence, but it's limited to marijuana, to the relief from the following three conditions: severe pain syndrome, neuropathic pain, we'll look at that in just a minute, and spasticity due to multiple sclerosis. So the evidence is strong, but it's as a pain reliever, but it's limited to those three conditions. Neuropathic pain is chronic pain accompanied by tissue damage, and it's all related to these, or as a result of these conditions, and you can stop and look at that if you wish. Mental health disorders, moderate to heavy use, has been shown to worsen some conditions, or can worsen some conditions, specifically post-traumatic stress disorder, anxiety, and depression. Has been shown. It's not real causal, but has been shown. Profound marijuana use beginning in adolescence has been shown to lead to moderately increased risk for depression later on. And again, it's not causal, it's correlational. Marijuana, however, may have some positive effects on adult anxiety disorders, and the research is far from conclusive here. Far from conclusive for a variety of reasons. Marijuana use and comorbidity, that means one medical condition exists simultaneously with another medical condition. Now, there is little research to support marijuana as being a gateway drug. That is, it leads to other things. Marijuana use is associated with poor educational outcomes and higher school dropout rates. However, again, these are confounded. These results may be confounded by these things: mental health, poverty, adverse childhood experience, or social exclusion. A strong comorbidity exists between marijuana use and depression and anxiety disorders, but it's correlational. We don't know if it's a self-selected population, if this population is smoking marijuana to get relief or to self-medicate. People who use marijuana had 4 times greater risks of depressive symptoms, especially suicide ideation. And again, correlation does not infer causation. Marijuana has not been shown to cause these. So we don't know if these people in that group tend to smoke marijuana or if marijuana leads to these conditions. We do not know, all right? There is some evidence to support the consideration of marijuana for anxiety disorder. However, much more research is needed. Half of daily adolescent users are likely to become dependent substance use disorder, marijuana use disorder, or cannabis use disorder. In a 2006 study of 600 adolescents with marijuana use disorder, 77% had ADHD, 74% conduct disorder, 38% depression, 29% anxiety disorder. And do not get the idea that marijuana causes these things. People with these conditions may have sought out marijuana as a form of relief. Correlation does not infer causation. However, we do know that treatment of recurring mental health disorder improves the likelihood of reducing or abstaining from marijuana use, all right? If you deal with the mental health condition, the adolescent is far less likely to use marijuana, far more likely to reduce or abstain from marijuana use. In the same way, marijuana creates barriers to actually treat the mental health disorder.